The broadcast is now starting. All attendees are in listen-only mode.
Good morning, everyone. Today is Friday, January 27, 2023. I'm Dr. Smalls, Director of Professional Development for the Maryland Department of Health's Developmental Disabilities Administration. We welcome you to the monthly series of the DDA updates with Deputy Secretary Bernie Simons. On the panel today, we have Bernie Simons, Deputy Secretary for the DDA, Rhonda Workman, Director of Federal Programs and Integrity, Nick Burton, Director of Programs, Robert White, Director of Administrative Services, and Jennifer Metrick, Executive Director of the Liberty Healthcare Corporation. Before I begin, we'd like to go over a few things about the webinar. One, all participants are in listen-only mode. There are two options to hear the webinar by computer and phone. If you look at the panel interface on your right, labeled audio, you can click either computer or phone to switch for the best option. We will be recording the webinar and posting this session on YouTube and the DDA website. Today's PowerPoint has also been uploaded as an attachment and is available for you to download in the webinar panel box. If you are listening by phone, you may also request to have it emailed to you. Questions can be typed into the question or chat box in the webinar panel, and we will get to those at the end of the presentation. And now I'd like to introduce Deputy Simons. Good morning.
Good morning. Happy Friday to everybody. And thank you for being here. So let's go to the next slide. So I want to thank everybody for joining our monthly community webinar. You know, I look forward to sharing some important updates with everybody. And I hope everybody had a wonderful holiday season, since we haven't had a webinar since before the holidays. So I hope everybody did well and had a good time with family, friends, etc. So it's my pleasure to share with all of you that we have a new health secretary, as many of you may have seen the announcement, Dr. Laura Herrera Scott. And I'll share a little bit more with her background in a minute, but I would be remiss if I started the webinar without welcoming our new health secretary that was appointed by Governor Westmore. Additionally, Rhonda Workman and Nick and Burton and Robert White will be providing some updates related to the areas that they have oversight and responsibility for. And you'll be hearing about the Appendix K updates on our waiver renewals, stakeholder input processes, self-directed services, recent communications, and our upcoming person and family forum, as well as other administrative updates. And lastly, you're going to hear about the Quality Improvement Organization, i.e. Liberty Healthcare, from Jennifer Metrick, who's the Executive Director of Liberty. Next slide, please. So this is Dr. Herrera Scott. As I previously mentioned, she was appointed by Governor Westmore as our new secretary. She brings a lot of experience. She was the former Deputy Secretary for Public Health here in the Department of Health from 2011 to 2014. She's got all kinds of experience in population health, equitable health outcomes, and data-driven results which will guide our agency well. And again, it's my pleasure to welcome her to her role here as our leadership, and we'll look forward to her knowledge, guidance, and vision as she works with us within DDA as our secretary. And then lastly, before we move on to our DDA updates, I want to congratulate Secretary Carol Beatty in her continued leadership as the Secretary of the Department of Disabilities. She was also appointed by Governor Moore to stay on in his administration, or the Moore-Miller administration. And, she brings a lot of wealth and knowledge to the table, and she's been great collaborator with DDA, and as we move forward with everything we do about waiver renewals, self-directed services, supporting families, etc. So with that, we can go to the next slide, please.
Thank you, Bernie. Good morning, everybody. My name is Rhonda Workman. I'm the Director of Federal Programs and Integrity, and I'm happy to join you today to share some updates on our Appendix K, our waiver renewal proposals, the new DDA policy stakeholder input process, and self-direction. Next slide, please. So first, let's start with a few updates related to the Appendix K flexibilities and unwinding. In terms of the meaningful day service exception, we would like to clarify that this flexibility applies to providers billing in PCIS and providers billing in LTSS. A provider may bill for the entire day only if provides the person with at minimum 3 hours of cumulative supports. We have updated the termination chart and related Appendix K memos to note this clarification and included some links here on this slide for you. Please reach out to your regional office for any additional information for how to submit claims. Next slide, please. This slide is an update to the recent Appendix K revisions that we submitted to the Center for Medicare and Medicaid Services, or CMS. Last month, we shared that CMS had shared some initial questions regarding our Appendix K revision. CMS has approved our request to revise the Appendix K to clarify additional reasons for the rate increase due to isolations, which was already in our guidance, to clarify staff training related to flexibilities continuing as per our winding strategy through June 30th. We also increased our slot categories that had supports for people during the public health emergency. CMS is further assessing our request to end the residential retainer payments that we had proposed ending on September 30th, 2022. CMS is considering whether ending the residential retainer payments will impact the state's federal maintenance of effort requirements for the enhanced federal match under the public health emergency. The department is waiting further information and instructions from CMS, and we will be providing updates as we receive them related to their guidance on ending the residential retainer payments. Next slide, please. In terms of our waiver renewal, we're happy to report the current status of the waiver and the next steps. Yesterday, the department's Office of Long-Term Services and Supports, known as our Medicaid office, submitted the DDA waiver renewal proposals to the Center for Medicare and Medicaid Services. Our next steps includes posting track change documents and a stakeholder summary document to the dedicated DDA waiver renewal pages next week. CMS will be reviewing our proposals, and then we'll reach out to Medicaid for any further discussions or questions related to our proposals. We are seeking a CMS approval with the effective date of July 1st, 2023, and DDA will then be updating policies and guidance after CMS's approval to align all our guidance and policies with that July 1st, 2023 effective date and revisions that are required. We will then follow up with DDA stakeholder information and training related to the changes. We will continue to keep you updated and share an email communication to let you know when the proposal and that stakeholder summary document has been posted on the DDA webpage. Next slide, please. Last month, we also shared that the DDA was going to be rolling out a new stakeholder input process. The DDA is committed to seeking input on policy proposals from participants, families, coordination of community service agencies, community providers, and advocacy organizations. We are happy to share that we will be sending out our communication for our first set of policies for review on Monday, January 30th. we are seeking your input related to our draft policies for assistive technology and environmental assessments and environmental mods. We noted here that environmental assessments and environmental modification services are all noted under one policy. So again, we'll be sharing the two policies for your input. You'll be able to access the proposed policies at our dedicated website. We've included the link here. They will be posted on or before January 30th, 2023. The DDA will also be sending out a communication on Monday, January 30th, to alert you to the policies being posted and provide information. Next slide, please. It's important to note that the policy proposals will be based on the current approved waiver services. For example, under the current approved waivers, environmental modifications are currently limited to $15,000 every 3 years. Our renewal proposal is to increase this limit to $50,000 every 3 years unless otherwise authorized by the DDA. So the proposed policies that you will see on Monday will reflect the current limitation, which is the $15,000 limit. Again, changes noted in our waiver renewals will be updated next spring prior to the July 1st, 2023 implementation date. Next slide, please. This slide includes some tips for submitting comments on the assistive technology and environmental mods environmental assessment policies. They include pointing to specific policy sections when you're providing your comments. For example, our policies have a standard format. We have a section for definitions, criteria to be eligible, special requirements and limitations, and other categories. So in your comments, please be specific to the area and provide specific recommendations and suggested revised language when possible or appropriate. If you disagree with a part of a policy, please suggest an alternative so that that can be considered. And please comment on information for which you also agree. Next slide, please. Public comments on the policies will be accepted beginning Monday, January 30th through February 13th. Please submit your comments electronically to our dedicated email address, which is noted here on the screen. Or if you prefer to send in handwritten or paper documents, you can mail them directly to the DDA Federal Programs Unit at the department with the address listed here. When submitting emails, we're asking that you include in your subject line the specific reference to the policy so that we can identify. For example, for comments on the assistive technology policy, the email subject line should read, "Input on assistive technology services policy." If you have any questions or need any accommodations, please reach out to the DDA Federal Program Policy Lead, Danielle Coles. We've also included her email address on this slide. Next slide, please. This slide is a screenshot of the DDA's new policy stakeholder input web page. To access this page, you can use the left navigation panel on the DDA homepage, where you would click on Policies, Regulations, and Forms link, noted here with the red arrow. This will take you to a page with a direct link to the policy stakeholder input page, and the policies will be posted on Monday. Next slide, please. We also wanted to share that the DDA's frequently asked question document has been updated with information from past webinars, trainings, or guidance that we'd received. We've included a link here on this slide so that you can easily access the frequently asked question. As we have done in the past, you will see that in red, we've noted whether information was updated or new in those sections. Next slide, please. Now I'd like to share a couple updates and reminders for self-direction. We'd like to review some critical processes that need to be completed as part of the financial management and counseling services transition. We understand the importance of ensuring all participants and their employees and vendors are cleared to work with their chosen FMCS, and that employees and vendors are paid. We know that participants, employees, vendors, and team members, the FMCSs, are all working hard to support the transition and to ensure the documents are received, tax forms are completed, timesheets are submitted, and processed timely. Each FMCS agency is implementing its own customer service and electronic billing system. The DDA is working with each FMCS and participants and their teams to support this transition and are available if you have any questions, concerns, or challenges. Please reach out to us. Next slide, please. As part of the FMCS transition, both the participant and their employees and vendors must complete the FMCS agency's processes and required documents, including tax forms. Completing both the FMCS participant and employee onboarding process is important in order for the employees to be paid. The participants' onboarding process includes establishing them as the employer record and getting them an employer identification number and other processes to identify them under the IRS. Employees' onboarding processes include confirming qualifications such as first aid and CPR certification, background checks, and other requirements as per the federally approved waivers. They also need to complete employee-related forms. These include all tax withholding forms such as the W-4 and MW-507 forms, employment verification, often referred to as I-9 forms, and also they need to indicate their preferred payment method, such as direct deposit or receiving a paper check. Each FMCS agency has implemented their specific onboarding processes. Two of the agencies utilize in-person and virtual options to complete forms electronically. Another agency uses paper forms to complete and asks that those forms and documents be submitted via mail. They also will be transitioning to an electronic model in the future. It is important to meet with and respond to your FMCS to ensure that the onboarding process is completed and the employees are cleared for payments. All paper documents, if you're using the paper process with your FMCS, need to be completed and signed. We know that participants and employees are working hard to ensure that these documents are done, and FMCSs are working to follow up and ensure that they're receiving that information. So we appreciate everyone's effort in trying to support the transition and be responsive. Next slide, please. This slide includes links to recent communications that we have shared related to self-direction. Please note that due to some of the challenges for participants and their employees in utilizing or accessing the FMCS systems, we are continuing to support paper timesheet submission. If you're not able to utilize your FMCS billing system, paper timesheets can continue to be submitted through the end of February. We've also provided some links to some clarification related to people who were previously supported by MedSource and other questions related to electronic visit verification and other hot topics and reminders. Again, we appreciate all your efforts and support as we work through this transition, and note that the DDA Regional Office Self-Directed Leads, Christy Culbreth, DDA Statewide Coordinator for Self-Directed Services, and Monica Harari, the MDH Financial Management and Counseling Service Program Manager, are all available to support you in any challenges, questions, and concerns. We appreciate all your efforts. Next slide, please.
Thanks, Rhonda. Hi, everybody. This is Nick Burton. I'm the Director of DDA's programs. And today I'm just going to talk to you about a few things. Our LTSS transition update, emergency plan requirements. We sent out a communication regarding that specific to our Meaningful Day, Vocational Day programs, our sole practitioner agreement, and finally, just a little plug for our family forum that's coming up. So next slide, please. The LTSS transition, as you all know, we are in phase 3A, which runs from January to April 2023. We had 35 providers transitioning into LTSS during this phase. We had 26 of those providers were going in for all their services. 9 were partial. And that is going to result in 2,886 PCPs being processed by CCS providers, regional offices for the LTSS Transition 3A group. In terms of the February 1st go live breakdown, we're in a really good position with it being about 4 days before February 1st. We had 11 providers going live as of February 1st. Of those 11, 3 were going in partial for their services, but 8 were going in all in, and that was 681 PCPs. As of this morning, the data shows that we are 93% ready to go. PCPs are ready to go for February 1st go live. So I have no concern that we will not be at 100% by February 1st. So for those of you that are in 3A, I know that this has been a lot of work, and so I think you've done a wonderful job. And again, I just want to say thank you to the regions, to the CCS, and to the providers for all the work that they're doing here to make sure that this continues to be a successful project. So, and again, I'm going to plug, if you're interested in going into transitioning into LTSS, now is the time to start having those conversations with your regions to start planning for your transition in. So please contact your regional director. We don't want people waiting till the very end. As you know, our transition timeline is through 2024, but we'd really like to support you in moving in that direction now. Next slide. All right, so the emergency, our emergency plan requirements. So we send out a communication, gosh, I think it was a week or two ago now, specific to COMAR 1022-02-10B, which talks about the requirement for emergency safety plans for DDA residential sites, not vocational or day service sites. That memo was shared with OHCQ and reviewed with OHCQ, so they are aware of that. I do just want to remind vocational and day service sites of a few things. Per our waiver, you should have policies and procedures related to emergency backup plans in your policies and procedures. So I would take a look at those, make sure those get updated as necessary. I would also say emergency management conversations, particularly for those that are accessing their community on a regular basis through Meaningful Day services, that you're collaborating with the teams on responses and approach to emergency situations as they pop up in the community. Also, when you're at a local business, a job site, engaging in the community, it's important for Meaningful Day providers to be aware of local emergency response plans or specific business response, emergency response plans to ensure that we're following those. In that communication, we also provided a link to statewide emergency management partners, just to have a good understanding of locally in your local community and jurisdiction what the statewide emergency management plan is. And that will help all providers, not just our Meaningful Day providers, but residential providers as well. It's good to know what's going to happen in your local community and how to plan and prepare for that. Next slide, please. We also released in communication a week or so ago is the much anticipated sole practitioner agreement. The sole practitioner agreement is a very narrowly defined application for licensed professionals. So we have a standard application process for DDA providers. However, we do have licensed professionals through health occupational licensing boards in the state of Maryland that go through a pretty rigorous review in terms of a background check, credential check, similar to what the DDA has also done with providers in other areas in terms of those checks. This sole practitioner agreement is related to behavior analysis, the behavior analysts that are licensed through the Health Occupation Licensing Board, psychologists, nurses, social workers, speech language pathologists, and or physical and occupational therapists. There is a difference between a sole practitioner versus an individual provider. A sole practitioner, again, is licensed through a health occupational licensing board, where an individual provider may be a person who's got many years of experience and an educational background that would allow them to be able to provide a service to a person with a disability, say in personal supports. But it's different than being licensed through a health occupational licensing board that, again, does a lot of that credentialing background check to make sure that the social worker, speech language pathologist, nurse has the skills and the ability to and the background to be able to move forward and provide those level of services. I wanted to also share that this sole practitioner agreement is available for both self-direction and traditional model of service. I know that in self-direction, there are many opportunities for this to be utilized, given the option for people with their budgets to make choices about their services and what that looks like. But we also did make it available for traditional, our traditional model of service. And if you have questions about that, you can certainly reach out to your regional office, or you can reach out to Leslie Thompson, our Director of Provider Services. We also will be developing a guidance on provider application process that will include the sole practitioner agreement. And we will also be developing an FAQ regarding the sole practitioner agreement based on the questions that have come in regarding the sole practitioner agreement. I think the big takeaway here is this really allows for people to have expanded choice in who they're receiving their services from. And, you know, I want to alleviate any oversight concerns, particularly in the sole practitioner agreement realm, given the fact that, again, these professionals are licensed through health occupational licensing boards and are held to a code of conduct and are monitored by those health occupational licensing boards and are held to those standards. In addition to sole practitioners that are providing supports within DDA are also held to our policies and procedures as well, as outlined in the sole practitioner agreement. So I think this is a great opportunity. The application is on our website, and there's also a link here as well to access that. Next slide, please. And lastly, I'm super excited about our individual and our person and family forum. That is going to be Wednesday, February 15th, 2023. We are going to get out an invite next week with all the details in regards to location, in regards to any sort of accommodations that people may need, with a full agenda, just to give you a little bit of a preview, we are collaborating with the UMKC, the University of Missouri, Kansas City, on having a really robust conversation about how we can enhance our person-centered planning process to meet people's needs, and how we can incorporate charting the life course principles into that. This is also going to be a conversation that we have across our system, but we absolutely want to hear from people and families regarding that. So I did, if you haven't heard of life course principles or the life course framework, we have a link here for you to look at. And then we will be doing a guided conversation around that. I do also want to mention that this isn't going to be the only conversation that we have around person-centered planning and life course. This, and I want you all to view this as an initial conversation into what we're going to be doing over the next year, but we need to get the input from folks and see how they would like to be involved as we move forward with looking at our person-centered planning process and enhancing that. The other thing that we are going to have available at our Person and Family Forum is we have a variety of community resources coming. The Parents Place, Doors, Maryland Inclusive Housing, MTAP, a variety of other places, People on the Go, will be available to people and to families as a resource. And then also we are going to have a virtual option for people, as we understand that in-person may not work for everybody. We also understand that there may be travel concerns or pickup concerns in terms of kids getting out of school. So we wanted to make that as accessible as possible. I will say that in terms of a collaborative spirit, you're probably going to get more of that being in person, but absolutely those of you that are unable to participate in person, I think you're still going to get a really wonderful experience. So stay tuned for the actual invite, and I hope to see a lot of you there, and I'm excited for the day and the work that we're going to do together. So thank you so much for those of you that have already expressed an interest. Thank you so much to those that have assisted in planning. And also keep sharing that on Facebook so that we have more people that know that the Family and Person and Family Forum's coming up. Thank you. Next slide.
We can't hear you. Could we start over?
Robert, I think we're having some difficulty with your audio.
Yes. Can you all
okay.
hear me now? Okay, sorry. I don't know what happened. My screen just started to flash and go crazy here. Still doing that. So happy Friday, everyone, and good morning. Last week, or a copy of the governor's allowance for FY 2024 was made available for the general public. Next slide. Great, thank you. So the proposed budget for community services for DDA was $1.843 billion. That is an increase of over 20% over the current year, and most of that is due to provider rate increases, the 4% COLA that went into effect, as well as the additional 4% that was part of the governor's supplemental budget number 3 for FY22. the cost of new expansion, as well as the annualization of the previous year's expansion costs. Some of the highlights, we have an additional $51 million built into the budget to expand services and to reduce the waiting list, $11.3 million for transitioning youth to support 541 people, $910,000 for emergency placements, $10 million for the waiting list, $1.5 million for the waiting list equity fund, $5.5 million for low intensity support services. This is projected to help support more than 2,800 people. And then $20 million to fund provider rate increases for residential and meaningful day services in LTSS fee-for-service billing, as well as an adjustment to the transportation component for meaningful day services as well. Next slide, please. So if you reviewed the summary that came out, you'd see that there's the fight for 15 and accelerating the timeline to getting to a $15 minimum wage in the state of Maryland. So DBM put money into the budgets to help account for that by way of rate increases. And so that funding will be used to accelerate the COLAs, the mandated COLAs that would have went into effect in FY25 and 26. And then our budget hearings are coming up. We put the dates here. We're slated to go before the House on February 22nd and the Senate on February 23rd. Next slide, please. Provider invoices. We've done a lot of work internally in streamlining that process, including empowering the regional offices to process the invoices for their respective regions. And we're continuing to work on streamlining that process even more so that we can get to a manageable cadence. We are working on updated communication as a result of some of those changes that we made internally, as well as, you know, who the points of contact will be moving forward for folks who want to inquire about invoices and where they are in a payment cycle. We're also working on a future Lunch and Learn series. I think the first one will be around how to check payment statuses at the comptroller's office. And so please be on the lookout for that communication. Next slide. Oh, okay. Before I turn it over to Jennifer in Liberty Healthcare, just a quick note that we are going to be rolling out the applications for the competitive grants. We sent out a save the date, I believe last week, and we'll be having a webinar this coming Monday, January 30th, and that's scheduled from 12 to 1 p.m. And then we'll open the applications for those competitive grants on February 1, 2023. So with that, I'm going to turn it over to Jennifer at Liberty Healthcare to give an update on the QIO.
Thank you, Robert. Good morning, everyone. As Robert said, I'm Jennifer Metrick from Liberty, and we operate Maryland's Quality Improvement Organization. And we've been working very closely with the Developmental Disabilities Administration over the last several months, starting back in July of 2022. This initial part of the development of the QIO has been focused on developing evaluation tools and processes to help our quality enhancement efforts across the state and across our system. And now we're going to be going into our go live on several of our evaluations. We're going to be going live at about one evaluation, new evaluation per month over the next several months through the end of April. So we'll be walking through that today. Next slide, please. So this slide shows our quality framework for the QIO and talks about our scope of work. So the QIO is providing a continuous improvement process that will help us have a data-driven process for quality enhancements across the system. So the purpose of the data collection activities are to discover system strengths and also areas or opportunities for improvement to ensure all participants receive quality services and are able to live their best lives. So more specifically, the QIO data collection activities will answer questions, including system compliance questions around our Centers for Medicare and Medicaid waiver assurances. So are we meeting compliance across the system? How well are services being delivered? And are services having a positive impact on people's lives? So you can see here on the left-hand side of the screen are those three main areas of our scope of work for the QIO. So they include the Council for Quality and Leadership Network Accreditation. So the QIO is participating in data collection efforts to support the state achieving network accreditation within the next 4 years. So that's our goal, trying to move the system towards person-centered excellence, and this is one of the ways that we'll be able to do that. We'll also be able to incorporate the voice of participants and family and or guardians as part of this work through the National Core Indicator surveys. So we have in-person surveys as well as mailed surveys, paper surveys for families and guardians. And then that component around the CMS waiver assurances, the monitoring of basic compliance and utilization is also part of that scope of work. And we'll be doing that through a series of data collection tools and processes. So we'll have our targeted case management reviews, our provider utilization reviews. There's going to be on-site qualified provider reviews as part of this work, our health and welfare reviews, and then that work around CQL, the personal outcome measures, and the basic assurances. Those are also on-site reviews with providers that will be combining with the qualified providers to reduce duplicacy and also make sure we're only having to come into provider agencies once, and then also our NCI surveys. So all of this information is our baseline data collection to be able to analyze and be able to show those strengths and gaps in the system. So it's a continuous effort, consistently reevaluating at every data collection time period, each of these core areas within our system. All right, you can go to the next one. Thank you. So we wanted to provide some updates on where we are right now. So we'll start with the CQL network accreditation. Many of you participated in the webinar that was held in late November. That webinar is available on the DDA website as well as the Maryland page of CQL's website. That's a great grouping of information around what network accreditation is, what does it mean to participants and families and providers within our system, and how are we going to achieve person-centered excellence as part of that process. The next part of the work that we'll be doing with CQL is we've already have the staff from Liberty are trained in the personal outcome measure. Now we're going to be trained and certified with their basic assurance reviews. And so we're going to be launching training for the QIO staff and DDA staff in mid-February. And then we will be doing the basic assurance reviews as part of accreditation with the CQL experts on site. And so we will be looking for actually volunteer provider sites for those basic assurance reviews. So as we're getting accredited, we need to do this obviously with real providers in real time. And so we have 3 dates that we're looking for 3 providers per date to volunteer to be part of this process. And we'll be sending out more information on this through a communication. But I wanted to just point out those dates that we'll be looking for providers to participate with us in basic assurance reviews is April 18th through 20th, May 9th through 11th, and May 23rd through 25th. So these are 3 to 4 days that we would be on site with the providers and CQL doing the basic assurance review. We need a total of 9 providers to step up as part of this process. So then in the spring, we will be also doing provider education and training around basic assurances. So we'll be offering multiple opportunities for live webinars so that questions can be answered. CQL will be providing those webinars to really go through the components of basic assurances, what to expect, and how providers will be participating in those as they launch after we are certified. So the next area of updates is around our National Core Indicator surveying. We have completed over, or are scheduled to complete over 130 interviews to date. So that work is going really well. We're able to connect with participants so that we can get their firsthand experience and level of satisfaction with services. And then we have about 400 families who have completed the family surveys. So we are coming out with quite a few strategies to continue to connect with participants so that we can reach our goal of at least 400 people participating in the NCIs by the end of June. All right, and so then our next area that we want to give you an update, we do have a QIO collaborative work group that is meeting monthly. We have had 4 sessions so far with the collaborative work group. They have been instrumental in helping to provide feedback on especially 2 of our processes, our targeted case management reviews, as well as the utilization reviews. And so they have been providing feedback as part of those as we are getting ready to launch. And then the final 2 areas that I wanted to talk about today is we will be going live with the targeted case management reviews next week. So we have piloted our series of targeted case management reviews that includes 3 different reviews. And looking at initial level of care determinations for new enrollees is one of those reviews. The other is a comprehensive case file review that looks at anything from the person-centered planning process to monitoring and follow-up. And then the third component is the billing component and looking at the billing activity notes that have been submitted for payment for targeted case management and making sure that only billable activities have been billed and not non-billables. So those are the 3 components of the targeted case management reviews, and they will be going live, and communication will be going out shortly that describes every step in that process. There's a detailed standard operating procedure that we've gotten feedback on from several groups, particularly the collaborative work group, and we are now have that finalized, and that will be going out any day now. And then our Our final component that I wanted to give updates on today is around the utilization reviews. So we are just wrapping up our pilot with 5 providers who stepped forward and helped us to pilot the utilization review tool and process. We've met with 3 of the 5 providers to walk through all of the findings from those reports. We've provided an initial summary of those findings. They're able to provide us additional documentation, supplemental documentation if they had any unmet findings. They will then get a finalized report. All of the findings as part of the pilot are just for learning purposes only. They are not to potentially recoup payment or provide any corrective action. This was a process just to help the QIO get the tool right, the process right, make sure there was consistency, and really learn from the 5 providers who piloted this process with us. So that review is set to come out and go live at the end of February. So we'll have more information related to that in the coming weeks. You can go to the next slide, please. So just in summary to close so that we can get to questions, this is a draft timeline. This is the rollout schedule as it is right now for each of the reviews for the QIO. So you can see that we're piloting each review before it goes live, getting feedback as part of the process, and that you can see that we're at a steady cadence here for release over the next few months of 1 review per month. All right, so the next slide just has my contact information. If anyone has any questions, or if you would like to participate in CQL's basic assurances as we're getting our staff accredited or certified, please reach out to me, but also look out for further communication. And now I'll hand it back over to Deputy Secretary Simons to close us out.
Next slide, please. So this has got the link that you see, and I thank everybody for attending today. If you could share the link with your colleagues, families, participants, everybody, to see if there's more interest about hearing directly from the staff at DDA and our contractors like Liberty for our quality improvement organization. And then after you register for the webinar, you're going to get your confirmation email and containing information about joining, etc. Again, I want to thank you for your time today. And if there's questions in the chat box, etc., my staff would be, and Jennifer, very happy to answer. So again, thank you, and have a wonderful weekend.
Thank you so much for posting your questions. We have just a few minutes left, but we'll try to get through as many as we can during this time. First question. The self-direction FMCS and EVV transition has been challenging for SDS participants, and there have been some problems. The EVV system seems to have some challenges. How is DDA attempting to resolve some of those concerns?
Yeah, this is Rhonda. I'm happy to share some information, and then Robert, you may want to add some additional information. We are working diligently with the FMCS agency to address concerns and issues that have been brought to our attention. We have established daily meetings related to them, and they are working through their ticketing system, making off-cycle payments to individuals as they discover and able to process people. As I shared in our slides, there's multifaceted actions that need to happen for the transition. Participant needs to be set up. Employees need to be set up. People need to have access to their FMCS billing system and have training related to that. So we're focusing on those core areas and trying to provide support and technical assistance to the FMCS as they roll out their business model, in addition to responding to participants, employees, and their teams, and trying to make those linkages with the FMCSs. So we are aware of those challenges. We are very sensitive to the payments and know how critical it is for those to be made, and are requiring off-cycle payments to be done for that. Robert, did you want to add anything else related to that?
No, Rhonda, but I think it might be a good idea to take an opportunity here just to underscore some of the guidance that we've sent out, if you don't mind. For example, as folks are getting through this learning curve, through this 6-month pilot that we're in, that they can continue to use paper timesheets, et cetera. Do you mind just reinforcing some of that guidance that we sent out, just in case some folks didn't receive it?
Sure, absolutely. And to clarify what Robert is saying, one, we have the slide that's got the links to some of the guidance there. If individuals are having challenges utilizing the FMCS system, specifically that they've been using the ARC previously and are used to using paper timesheets or their Paycom system, we have put out guidance that you can, if you're not able to use their EV system, then you can submit paper timesheets. It's noted in the guidance. We've extended that through the end of February and noted the information related to how to submit that. So that is still an option to support you so that that can go forward. If you're able to access the ARC's EV system, please access it. Please submit your timesheets that way. And the payment will go through. But if you're unable, you don't have logon information, there's a system issue with it, then that's when you'd use the paper timesheet. And then Robert was also referring to electronic visit verification, where we have a 6-month transition process as everybody is learning the system and utilizing that, and that's also reflected in our guidance.
Thanks so much, Rhonda. We're at the end of our meeting today, and we want to thank you for attending today's webinar and posting your questions in the question box. As always, we value this feedback, and we will review and respond to these frequently asked questions by our regular updating of the DDA's FAQ document. Please stay healthy, and thank you again for your dedication to our DDA community. We hope to see you at our next webinar, February 24th, 2023, from 10:30 to 11:30 a.m. As the Deputy Secretary said earlier, happy holidays. We're moving into a lot of different seasons of celebration. See you. Thanks.